love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. I am Shavani Nisbet, your health educator from the Health Promotion Unit, in with this week's edition of Health Matters. A healthy lifestyle is important, as we should all know. And here with me today is Nurse Eldina Farrell, Education and Prevention Officer from the Health Promotion Unit, and we will be having a short discussion on healthy lifestyle, what you can do to keep a healthy lifestyle going, and what you should do if you haven't been living a healthy life. Good evening, Nurse Farrell, and welcome to Health Matters.
Good evening, Shavani. Thank you.
Okay. What is healthy lifestyle, and why is so much attention being given to a healthy lifestyle?
Well, a healthy lifestyle is the steps, plans, decisions, and so on that you put in place to achieve optimal or the best possible health. So whatever you have to do, whatever actions you have to put in place, whatever steps you have to take in your life, and the decisions you make, that can help you achieve the best possible health. That is what we refer to as healthy lifestyles.
Okay.
And the reason why we're paying so much attention to it is that we know for some time the leading causes of hospitalization in St. Kitts and Nevis and most Caribbean islands. Two of the leading causes for hospitalization is diabetes, high blood pressure. We have seen an increase in non-communicable diseases such as diabetes, high blood pressure, cancers, heart diseases, and so on, and the complications like chronic kidney disease and so on. And so we are trying to build quality into people, build quality lifestyle changes so that these can be reduced considerably. Because we are seeing young people being plagued by some of these illnesses, and they are very costly. In addition, they are very costly.
Right.
So that's one of the reasons why we are paying so much attention and trying to promote that as early as possible you start taking steps to live a healthy lifestyle.
Right, it's important. How important is eating nutritious meals?
Well, what you put in is very important because it will show.
Yes.
And your body needs nutritious or nutrients to repair cells. You need nutrients to even see me properly. You need good nutrients for that. You need vitamins A, you need your vitamins, your minerals, and you need to eat adequate amount of protein, especially for growing children, so they can build build muscles and so on, and the skin need to repair, and so that is important. You need adequate amount of fruits and vegetables as well, because these help to keep your body healthy. They boost your immune system. And in addition, they help you to get rid of toxin, because you won't get as constipated as persons who don't consume enough fruits and vegetables. So it's important that you eat proper nutrition. Furthermore, it helps to decrease the incidence of diabetes, high blood pressure, some cancers. The healthier your diet. And so we say, try to stay clear of trans fat found in a lot of things like biscuits and so on.
Chips.
Right, those baked goods. Try to avoid saturated fat, animal fats. That's why we encourage you to trim your chicken when you're cooking it, clean, remove skin and so on. And unhealthy oils, and we recommend olive oil, canola oil for cooking and so on. So, and of course, what's your salt intake,
Yes, that's important.
and your sugar, because they are not really part, high salt and sugar intake are really not a part of a nutritious diet. You need them, but you don't need as much as we are using, right?
And let's talk about portion sizes when you're eating a meal. How important is portion size and what should the portions be?
Nutrition is very important because your body needs food to make new cells and to keep your organs functioning. But in nutrition, you have to choose food if you're going to be properly nourished. If you're going to receive all the important nutrients, you have to choose foods from each of the 6 food groups. You also have to limit the use of foods and drinks with added salt and sugar, and you have to use less fats and oils when preparing and cooking food. You have to also eat a variety of fruits and vegetables daily and use less salty and processed foods. But it's important for you to not just exercise, but also to eat a very, very healthy diet comprising of adequate amounts of the 6 food groups.
Okay. Should one just focus on eating healthy or should they also include exercise as part of a healthy lifestyle plan?
Exercise is important because if you're just going to eat healthy, it's not enough.
Okay.
You have to get up and move around, exercise at least 30 minutes for 5 days per week or 150 minutes per week. And you can walk, you can run, go swimming, things like that to help boost your immune system, help you feel better about yourself, help you look better because you're more toned and everything. And it does do wonders for your heart. It does help to reduce cholesterol levels and your blood pressure and keep away things like type 2 diabetes. So exercise is important. And your brain function better when you're active. So you will do better in your schoolwork, on your job, and you'll just feel better about yourself.
Tell us about the importance of sleep and relaxation.
Well, just like your computer have, I think it's F5.
Yes.
Refresh. We need to do that because you need to relax at the end of the day, give your body a chance to do the work that it has to do.
Right.
You know, now and again you bring in a maintenance man to check your equipment and so on. And so they get a chance to recover because you're basically giving them a rest and somebody is checking on them.
Right.
Your brain needs to do that for you. You need to sleep at least 7 to 8 hours for adults. Children, depending on the age, maybe up to 10 hours or more. Well, at least 10 hours sleep. But we need that because in order for your brain to function, in order for you to concentrate better on your job or in school, you need to get adequate sleep. So sleep is important. Even when you're driving, if you don't get enough sleep,
Don't drive.
poor concentration, and that can cause accidents.
Right. That's
You know, so your body needs to get a chance to rest, relax, and repair.
And sleep is one thing when the body is ready to sleep. That's it.
Yeah, but some people fight it,
Yeah.
right? And then they start feeling very groggy, very tired, very confused. And the worst thing is if they go out and drive a vehicle at that point in time,
Yes.
because they may not be able to concentrate to really reach the end of their journey. They may very well get an accident. So we encourage people to get at least 7 to 8 hours sleep.
Okay.
Yes.
A lot is being said about water. Do you think people are drinking enough water?
I think we do a lot of drinking. Maybe not enough water because I have not done a survey, but a lot of people who I interact with would say, oh, I drink a lot, but I don't like water, or I can't drink so much water.
Right.
But it's good. Your body, our bodies, is made up of, is 2/3 water. So we really should use at least 2 liters of water to replace what we pass out. Water helps to prepare your stomach or your body for digestion of foods that you eat, and it helps in the elimination of toxin. Because if you don't drink enough water, you get constipated.
True.
You need water to concentrate better. If you're dehydrated, you find that you may have a headache, or your head just feel, as we say, groggy or funny. Sometimes it's the water that you need. You also need water to help you control, or should we say, your electrolyte balance. You need that.
Okay.
If you get dehydrated, you can have serious problems. So drinking water is important. Are people drinking enough water? I think a lot of people are not drinking enough. 8 to 10 glasses. People say, what? And so they drink things like, men drink beers, and beers are alcoholic beverages. Now, alcoholic beverages tend to dehydrate you rather than hydrate you. You pass a lot of urine, it acts like a diuretic.
Oh.
So you should drink fruit juices, and that would make up for some of the water. Eat things like watermelon, and but drink water. Get accustomed to drinking water. It's good for you. It's healthy. It doesn't have any sugars like the sodas and so on. So.
And when you increase water in your diet, you can actually see the difference.
Yes, your skin tone is better. You're able to function better because your body needs the water. And children who, I know it's kind of dry right now, and there are children who have things like asthma. It's hot too, so we have to keep them hydrated. If they don't consume enough water, they would have asthmatic crisis more often than children, given that you have triggers like dust. But what I'm saying, if they're not well hydrated, it is also bad for them.
I didn't know that.
Yeah.
Okay. And so what color should your pee be that would indicate to you that you've been drinking adequate amount of water?
Well, it should be straw colored, and that's like a light yellow, just a hint of it, should be what we call straw colored. If it is dark, you go in the bathroom and you pass urine and it looks dark, you say, wow. And you would say, oh yes, I haven't had a glass of water yet for the day.
Right.
And maybe it's already noon, because it happens.
Yes.
So you go and you drink, and when you go to the bathroom again, you would
like
find that it's normal color.
Right.
Yes, so you just have to drink water. If you can't have water at that time, for whatever reason, and you can use some watermelon or something, you can do that.
Okay.
But, it's best to keep yourself hydrated with enough water.
Okay. And Culturama is coming up, the festival for the summer, and the people are going to be drinking alcohol. Do you have any advice for those who will be consuming alcohol?
Well, first I would say, if you can't drink, stay away from alcohol, because alcohol impair your judgment.
Right.
If you're like me, I can't even smell something that has alcohol in it. I can't tolerate alcohol, so I stay clear of it. But if you know you can drink, bearing in mind that it can become addictive,
Right.
so watch your portion, watch the amount that you drink, limit the amount that you drink. Because alcohol, again, drugs, impair your judgment. If you take too much and you become what we call drunk and disorderly, you may get in an accident if you drive. You may not come out of it alive. Or you may take somebody out of this life through an accident. You may hit somebody and kill them. Another thing that can happen when it comes to sex, you may wake up somewhere where in your right mind you wouldn't want to wake up, right?
Right.
So if watch how much you drink. It's a serious thing about it, that if it becomes if you become addicted to it, it affects all your organs, all the organs of the body, your brain, your liver, your heart. So it is not the best thing to drink if you can't control yourself. Remember what we said, a lifestyle, healthy lifestyle is steps. And the steps you take, decisions you make to achieve or maintain optimal or the best possible health. So if you know you can't drink, if you know you're going to take a glass of whatever it is, rum or whatever, and you're going to keep going back for more, maybe the best thing is to not to take it in the first place, right? Because it affects all your organs, and it really, it causes serious problems in the family, alcoholics. It's a disease.
I agree.
And it causes serious problems. Persons have been known to lose their jobs because they can't control their drinking and stuff like that. So watch what you drink though, and how much.
Yes.
A little social drinking, nothing wrong, but if you find that you're going beyond that, you seek help, because alcoholism is a disease. It's very difficult to manage.
That is true.
And that's why we are talking prevention.
Yes.
You see?
Yes.
Prevent it. Don't start it and then say, hey, I really need some help now, because it's difficult for them even to admit at that point that they need help.
Okay.
Right?
Yes. What is your advice regarding screenings and regular doctor's visits?
Well, I would say, as I normally say to people, listen, you have a vehicle and you take it to the mechanic every now and again. Some persons have had their cars checked twice for the year, right? And they haven't gone to the doctor in 5 years. But if you're in good shape, I am not saying that you shouldn't service your vehicle. That's not what I'm saying. But I'm saying if you, the driver, is in good shape, good health,
Right.
you've been getting checks by your doctor, having your checks at your doctor's, and something goes wrong with the car, it's easy for you to manage because you're alert, you can sense this thing, you realize your car don't sound right, so you can pull off at the side of the road, right? Mm-hmm. But if the car that is serviced frequently by the mechanic is in good condition, has a driver who is not feeling well, the car can't say there's something wrong, so let me stop before we have an accident. The car won't say that. So I'm not saying you shouldn't service your vehicle, because I service my vehicle, but I'm saying you have to do both.
Right.
And so it's very important that you get your checks. You do screening you keep a check on your blood pressure, know your numbers, know what your blood pressure should be, normal blood pressure, your blood cholesterol, your blood sugar. Have your screening. If you are male, your prostate is important. Women, pap smears, breast exams, and so on, and mammograms at points, and so on. And of course, if you find that if you discover, or through research, you discover that your family members, even if they don't live in Nevis, but you get information that they have certain types of cancer or medical condition, it's important that you let your doctor know so that he can monitor, because some things are run in families, right? Some people, they have high blood pressure, some people kidney problems, diabetes, etc. So know your family history. And all of these you tell your doctor. When you go to your doctor, be honest. Don't hide things from your doctor, man. The doctor asks you if you smoke. He wants to give you some information. Maybe he realized the blood pressure is going up and he he would need to tell you, well, you have to cut down on that and eliminate it. So don't say, doc, me not really smoke. Tell the doctors the truth. Because if you don't tell them the truth, they can't help you. They can't give you the information. They can't treat you. They may not order the tests that are important too, because they don't know of that particular thing. So it's best to be honest with your doctors and get your screening. And remember, both your car and you need servicing from time to time.
That's a good one.
Yeah.
Good one. Talk to us about safer sex practices.
Well, safer sex is important. But you know, the safest sex is not sex.
Truth.
Abstinence.
Very good.
So we talk about the ABCs, and the young man laugh, right? We talk about the ABCs. A mean abstinence. And now, if you're going to abstain from sex, all well and good, you plan that. But if you're not going to abstain from drugs, such as alcohol and marijuana and so on, can you really abstain from sex? Because these things impair your judgment. So abstinence you have to abstain from drugs, alcohol, and sex. You can't say you're abstaining from sex and you go to a party and you drink so much that you don't even remember the names of some of the persons around you. You don't know what you're doing. Chances are you may have sex. So abstinence, 100% sure. Safe way.
Definitely.
Safest way. Only 100%, right? And B, if you're in a relationship, be faithful. If you have a nice looking, because beauty is from inside out, lady or a handsome gentleman in your life, be thankful and stick to that person. Stick to that person and have a meaningful relationship with that person. The promiscuity that we are seeing people are having many partners is very, very dangerous. It doesn't just affect your life in terms of sexually transmitted diseases, but it also, the more partners young ladies have and the earlier they start having sex, the more at risk they are for cancer of the cervix and things like that. There are sexually transmitted diseases in Nevis like herpes, hepatitis B, HIV, no cure. Right? So being faithful, know your partner, get your partner screen, come to the office anytime and both of you can get tested. And when you're sure about your status, you say, well, okay, you sit down and you make a plan again. Risk reduction plan, we call it, how you can stay clear of these sexually transmitted diseases. That's the be faithful. Now, be faithful means that both of you are faithful in the relationship, not 50% of the
relationship.
Right, is faithful. Otherwise, you're going to be prone to problems and diseases. And C, when all else fail and you think, well, partner, you can't be faithful, your partner can't be faithful, I guess your option is latex condom or polyurethane condoms, and those are the female condoms that we have, type of plastic, but latex condom is very effective. And another thing I wanted to mention for abstinence is for the young people, refrain from looking at, stop looking at porn. If you're looking at pornography, that is another thing that we have to instill in them because it's addictive.
Yes, it is.
It has made young people and older people too do things that they would not normally want to do. And porn sites are becoming so much of a easy access. You can just type in something. I think one of the first porn sites an adult lady was sharing with me that she heard of was a primary school child telling her about the site. You know, I mean, it's sad. It's sad. So we want to encourage children to, because it can be, it can make you, it can have the effects of a drug. And the sad thing is that children have access to these, easy access. As parents, I think we should look at what they call, I think, internet filter or website filters, where you can,
Block them from seeing certain
yes,
sites.
block,
Yes.
block. I think some sort of filters that you can get, and you can call IT filtering systems that block the inappropriate channels.
And
Yeah.
you see, the thing is, children share too. So if one child has been looking at a porn site, they're going to go back to school and talk about it. So everybody now interested in this porn site. Sites.
Yes, but it is sad because these things are inappropriate and they distort the child understanding of sex. Sex is a beautiful thing, done the right time with the right person, right? They shouldn't be seeing these images of things that portray sex in, in this kind of way. It is not nice that young children have access to these sites. So parents have to know what their kids are looking at. They have to know that computer can't, she cannot go on that computer and get these sites, access these sites. How? They get in touch with somebody who knows about these things and block those sites from their computer. And don't have, if your children are young, I don't think they should have computers. I mean, that's my belief. I can't force my value on parents, but have computers in their room. Bedrooms are made to sleep. And when your child go in their room with a computer, sometimes, and I'm saying this because of things shared by young people, sometimes they look at things that you wouldn't dream they're looking at. And if you are a parent looking at these porn sites, you have to understand you cannot be doing these things with your children around, because there are some children who indirectly were introduced to these by adults,
right.
by adults looking at these pictures, not realizing that the child is in the area and peeping, and so we have to, porn is another thing that we have to be careful with. And it's holiday time, that's why I'm emphasizing it so much. It's vacation time, and children, parents have to really block these sort of sites from their children and their home computers so that children can access them.
So I always encourage my peers and even other people, if you, let's say you're going to a new relationship, I encourage you to test, both of you to go and take a test, because the truth of the matter is, if you're in a relationship, both of you are in a monogamous relationship, the condoms tend to go out the door eventually. So I always advise for them to test, but there's some people who have the mentality, okay, we both tested and we are both clean, per se, right? And then that seems to be like a green flag. Okay, seeing that I'm clean, I could now go outside the relationship because I'm clean. So I just wanted you to touch on that a little bit.
First of all, I'm not going to believe anybody who just tell me
Right.
that they have a test, because a lot of guys and ladies do it. And I said to clients, they have to show you a paper like this, the form that we send to the lab. And it has to have here non-reactive to HIV 1 and 2. And that means that they're not infected. But it can also mean that the person is infected but is in the window period. That is, it's not showing up in the blood yet, because it's an antibody test and it takes up to 3 months for that to happen. So if you're in a new relationship and the guy or girl bring the paper and it says non-reactive to HIV 1 and 2, and you don't know too much about them, you understand?
Right. Yeah, I understand.
You should use a condom for a period of time and then retest. Make sure he or she is out of that window period. And then, of course, during that time you're talking risk reduction. How are you going to stay faithful to each other?
Why you should stay faithful
Why
to each
you
other.
should stay faithful to each other. And not just say, you know, if he give me HIV or she give me HIV, I'm going to do this, I'm going to do that. You have to plan ahead. But don't assume by looking at anybody because they say that they had a test and it's negative that is true. Because all that glitter is not gold. You can't look at somebody and decide what they have. So get them tests. And you have to do that before you start having sex with somebody. If a young woman in most cases start having sex and then try to get the test done,
Difficult.
it's not going to happen.
Nope.
The power has left her. Before she gives in to a gentleman, she have to say, listen, this is what I'm about. These are the ground rules when it comes to me. In a very assertive manner. Not aggressive,
Right.
but assertive. And say, this is what I would like from you because I want to stay healthy. So have your plan up before and know that it's not just HIV out there. There are herpes, hepatitis, and so on. And all of this can impact your life. No, HIV is not a death sentence, yes, but nobody wants these diseases, okay? So talk, dialogue before. Don't give in and then say, you know, I'm trying to talk to you and you didn't even listen. No, that should have happened before. Keep the power. I'm not saying you should be bossy or aggressive, but be respectful, but put the ground rules down and let him respect you and you respect him.
And for condoms, could you tell us where you can go and get condoms?
Well, we have condoms at Health Promotion, and they're sold at pharmacies, and all the pharmacies have
Right.
them, and supermarkets and so on.
Okay.
So, you know, health centers may have some, but generally Health Promotion distribute to the other health departments
For free.
for free,
Okay.
for free. And both male and female, we are not seeing people utilizing the female condom. And we really would like them to come in and take some off our hands. They're nice, I mean, they're effective. And, you know, we would like to see people using them. They're very effective.
So do you have any last words, any advice for the young folks, could be the older folks?
Well, advice, another thing that maybe I can end with is saying that family support is important in your life.
Truth.
Through good times, and especially if bad times come, you know, you have people in your life. Stay close to family, have friends. It's part of a healthy lifestyle. Not talking to your relatives, not having a friend except on Facebook is not healthy.
It's not.
So have friends, have your family there because in good times you need them to continue to encourage you, and in bad time you need their support. So, you know, just try to live a healthy lifestyle. Protect yourself from things that can hurt you or challenge your efforts in living that healthy life. And protect your family as well. Look after your children. Make sure, like I said, that your children during this vacation and otherwise don't have access to porn sites. It is fast becoming a problem. A lot of children are being exposed to porn sites, and they are confused as to what is right and as to what is wrong about sex. So as parents, you have to talk to your children. Don't be afraid. And stop calling the body parts by odd and strange name. Call them by the correct name. So children get in their head that that is something proper. Don't, when they say penis, say yes. And let them know vagina. Don't stop calling them by these little funny names, you know? And talk to your children. Ask them questions. Watch Lifetime sometimes, because sometimes they have some good movies that helps your dialogue with your child. Sometimes they have movies about, you know, relationships between parents and children. But, you know, talk to your children and make certain that you know what they're looking at and who their Facebook friends are,
That is very, very important.
who their online friends
Yes.
are, right?
Because the younger people are now getting Facebook, like the primary school children.
Really?
Yes. And I personally don't feel like in primary school you should have a Facebook page.
Because Facebook, everybody pops up there and asks you to be their friend, and I don't know.
And if you're
But
their
we
friend,
have to look at that.
yes, you're still exposed to whatever that person puts up, and some of them are way older, so therefore they're putting up things that are you as an older person would like a younger person to see. And so that's some of the stuff that we're exposed to, the young children are exposed to.
Yeah. And you have to also tell your children not to take pictures of themselves. Taking pictures of their
Body parts.
but you know,
yes.
I mean, not to do it, because later in life it's going to be something that you know, it's going to hurt you now, but as you grow up you're going to wonder, it may even affect you getting a proper job. So and these are some of the things I think they are spin-off from the porn. Looking at porn, I can't say, but I know there are a lot of young people who are looking at porn, and it's sad. And these phones, they're taking pictures, and I mean, why would you want somebody to see what God gave you that is so precious? No, you wait until marriage and, you know, you're in a proper relationship, you're a responsible adult, and then you do that, and you don't have to take a picture and send him. It's ridiculous. You don't have to do that. So we want to encourage parents to talk to their children about sex and about the spiritual aspect of sex too. How precious this gift is from God, and we shouldn't abuse it and, you know, just use it like it's nothing. And so that's it.
Thank you, Nurse Farrell.
And thank you for having me.
And that has been this week's edition of Health Matters. I am your host, Shavani Nisbet, health educator from the Health Promotion Unit. I would like to thank Nurse Eldina Farrell, who is the Education and Prevention Officer at the Health Promotion Unit as well. We are here to tell you about living a healthy lifestyle, so I encourage everyone to try to live a healthy lifestyle. Try and be as healthy as possible. Our fruit for the week is mango. Mango is a good source of antioxidants that can prevent cancer. It's also a skin cleanser, and because it's full of fiber, it helps in the digestive system. So eat a mango or some mangoes every day. We have them in abundance on the island, especially in Nevis. Thank you for listening and watching.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.